You're watching In View, and I'm Larry King. The world of human health and medical technology is experiencing exponential advances today. Across every spectrum of what we've called modern medicine, there are dynamic breakthroughs and improvements occurring that are paving the way for a healthier tomorrow. On this episode of In View, we're going to showcase those organizations and individuals that are making great strides in the collective quest to improve the human experience as it relates to our ability to live healthy and longer lives.
One reality of the aging process is that good health and quality of life often don't go hand in hand. For men over the age of 40, this reality means that the risk of prostate cancer must be addressed. Prostate cancer affects more than 230,000 men each year, making it the most common form of non-skin cancer and a leading cause of death from cancer in men. While these statistics may seem daunting, the good news is that with early detection and treatment, prostate cancer is curable. According to the American Cancer Society, most men who are diagnosed with prostate cancer do not die from the disease.
I think the early detection of prostate cancer is vitally important. I think it's one of our biggest tools against fighting the disease. The earlier you can find it, the earlier that you can treat it, and the better chance that you have for a cure. The screening test for prostate cancer, the PSA blood test, was started back in the 1990s. And since then, there has been a considerable decrease in prostate cancer-related death. And there's enough data out there now that shows the PSA screening test does in fact save lives and does in fact decrease the risk of dying from prostate cancer. The recommendation for prostate cancer screening is a gentleman that has at least 10 years of life expectancy. Men that are at higher risk of getting prostate cancer are African American men, as well as patients that have a family history of prostate cancer, such as a father or a brother. So I would be even more vigilant with those patients.
In addition to early detection, one of the keys to a successful outcome with prostate cancer is to choose the best form of therapy for each case. The treatment options are increasing, and this makes it especially important to work with a urologist in evaluating the risks and benefits of the available procedures. At medical practices such as Central Maryland Urology Associates, physicians guide patients in choosing the most appropriate form of treatment for their case. The options include watchful waiting, surgery, radiation therapies, cryotherapy, and the emerging field of Hifu, high-intensity focused ultrasound technology.
9 months ago, I went to Dr. Blumenthal because I was having problems with both urination and with erectile problems. I chose Hifu because I found it was a very successful procedure in curing prostate cancer. It gives me the lowest chance of side effects that one would worry about, the incontinence or the possibility of erectile dysfunction. And it does not involve serious cutting into the body, which could possibly cause infection and cause me to stay in the hospital for multiple days. This procedure is done in only 3 hours. You're in and you're out, and then it's completed. There's no other issues.
Hifu is a minimally invasive treatment for localized prostate cancer that does not require surgery or radiation. The procedure uses ultrasound energy to destroy diseased tissue with heat. Dr. Blumenthal has been performing Hifu since 2010, bringing the benefits of this outpatient treatment to patients, but not in the USA. Hifu is approved for investigational use only in the U.S., while a clinical trial is performed. But American patients can access the procedure in treatment centers operated by International Hifu in other countries where Hifu is approved for use. These locations include Canada, Mexico, and the Bahamas. With the Hifu technique, ultrasound energy can be directed at specific focal points to destroy only the targeted tissue. The individual sound waves do not harm healthy tissue outside the prostate gland, and the Hifu procedure can be used more than once if needed because the source of energy is non-ionizing.
Hifu is ideally suited for men who have prostate cancer that's contained within the prostate. that is, who have what we call an early stage prostate cancer. It provides for these men a great balance between treatment and quality of life. So the optimal patient who pursues Hifu today has an early cancer confined to his prostate and is very concerned about maintaining his quality of life, especially trying to maintain sexual function. Our typical Hifu patient is a man who is in his 50s or 60s. He has prostate cancer that's been diagnosed in an early stage, and he's very concerned about maintaining his quality of life. He's typical of most baby boomers today who are really worried about maintaining excellent sexual function and avoiding the need for incontinence pads or things like diapers. So our typical man really does research, he's well educated, he's looked at his options, and he makes the choice to pursue Hifu based on having the proper balance between treatment and maintaining quality of life.
Hifu also may reduce the risk of serious side effects, such as impotence and incontinence, that are associated with surgery and radiation. This reduction translates into quality of life improvements following cancer treatment.
We have 10 to 12-year data out now on Hifu patients, and we're seeing comparable results as far as cure rates to other forms of prostate cancer treatments. But the very exciting part about Hifu is that we're seeing men have better rates of keeping their erections and better rates of keeping dry and not having incontinence.
Whichever treatment proves most appropriate for each patient, one fact remains the same. A proactive approach to prostate health is built upon routine medical exams, which allow a urologist to monitor the patient's status and detect any cancer at an early stage.
Well, I think this has been, having gone through other procedures of more pretty intense, this was very, very easy. The people there at the hospital were really nice. They were very professional. The first night is a little bit tough. The bladder is sort of wanting to constantly want to go. But now things have settled down, and I think this has been a very, very successful procedure. I'm very pleased with the way this all went. From the very beginning, from the pickup all back to the drop-off. I think we did really very well. I'm very happy with what everybody did.
I would have to say my fears have been quelled. He has learned within a half a day to learn how to deal with it, and he came out of the anesthesia fine. As far as the procedure itself, I was assured, we were both assured by the doctors that it went flawlessly, and I think in time his PSA tests at 3, 6, and 9 months after will tell the story of how successful it actually was. But I'm confident that he will have low scores.